Good morning again, everybody. Thanks for joining us. Just waiting on a handful of other folks to jump on in. We'll probably get started in the next minute or two, but you are in the right place for the Augintel webinar. Thanks for joining.
Alex, how many more folks were you waiting on?
There were about 5 or 6 others, I think, that had registered, so we can give it just another minute, but we can get started. And I know we're recording and be able to follow up with others as well. All right, I think why don't we go ahead and kick it off, Brian, and then anyone who jumps on will be able to circle back if they miss anything in the beginnings. But we got a good audience here to get started.
Sounds good. All right. Good morning, everybody. For those of you who don't know me, Brian Borman, I'm the Executive Director of the Pennsylvania Children Youth Administrators Association. Thank you for joining today. I had reached out to Augintel and asked them to present on their natural language programming. Um, I'm sure I won't do this justice, and I'm sure Tracy and Alex will clean it up for me. But basically, natural language processing allows you to look at something that's not in a formalized data fields, and they can run searches through case notes or medical records or other things that will be able to pull out data points from what otherwise would not be readily searchable on our existing case management systems. And a very valuable and useful tool to be able to access some of that data that you might otherwise be missing. So I want to introduce Tracy Rordance, the Augintel Director of Customer Service, who spent 20 years in child welfare, starting as a caseworker, which is always near and dear to my heart. Start at the bottom and work your way up. A case management systems specialist, and she knows a lot about what we do. And Alex Goldman, the Augintel Director of Sales, and he leads the team for account management. So I'm going to turn it over to Tracy and Alex to give us an overview of the Augintel natural language processing.
Awesome. Thank you, Brian, and thanks to everybody for joining us and see some familiar names. I don't see any faces, but familiar names, and good to reconnect with some of you and see some new names and look forward to continuing the conversation. As Brian mentioned, I'm Alex Goldman. I lead the sales team here at Augintel and been doing a lot of work with a couple of counties in Pennsylvania and a handful of others that we're engaged in conversations with, and excited to share our story about some of the work that we're doing to help drive efficiencies across the counties as it relates to child welfare. With me, as Brian mentioned, I have Tracy Rordance. I'll kick it to Tracy for a quick intro, and we'll dig into the content.
Thanks, Alex. Good morning, everybody. My name is Tracy Rordance. I am in Pittsburgh in the very brutal cold this morning, so I'm sure you're all probably even colder than I am. Like Brian mentioned, I came from Allegheny County Department of Human Services, first as a caseworker, right, fresh out of college, actually as an intern originally. And then ended up stumbling into the IT world where I was really one of the folks who was able to help translate what's needed on the ground to our partners who were building our software. So I ended up actually being the project manager for Augintel in Allegheny, who still has the product today. And then decided I really liked the work so much, I came and worked for Augintel directly. So it's lovely to see all of you this morning. It's a small group, so I did go ahead and allowing your microphone and camera. So if you do have questions throughout, please feel free. This can be a conversation. If you do have anything that comes to mind, any thoughts or questions, feel free to unmute yourself or go on camera if you prefer, but that's totally up to you. So thank you. Back to you, Alex.
Awesome. Thanks, Tracy. And yeah, as Tracy said, feel free to pause us throughout with questions verbally, put them in the chat. Certainly many opportunities for us to follow up and engage in other conversations post. But what we planned for today is we'll go and do an overview of, Augintel and the problems that we help solve across child welfare agencies throughout the country. Jump into a software demo, share with you what our product is doing in counties across Pennsylvania today. And throughout, Tracy's going to be sharing updates on different customer success projects that we've been deploying across the country with our customers, and really at the end of the day, how they're experiencing value out of Augintel that ultimately is helping to promote critical thinking in the casework and promoting improving outcomes throughout the country. So thrilled to have everybody here today, and with that, I'll go ahead and get started. So who we are and what do we do here at Augintel? We are a machine learning software company entirely dedicated to child welfare and social services. We build products that focus on improving the delivery of care by putting narrative data to use. And we'll we'll dig a little bit deeper on that in just a moment. Our company has been around just a bit over 5 years, been live with clients now for a bit over 3. And you can see, we are working already in the state with Washington County and Allegheny County, as well as a handful of states throughout the country, including Illinois DCFS, Massachusetts DCF, Hawaii DHS, a handful of counties and nonprofit providers as well throughout. And excited to share our work with you and learn from you guys today. So the problem that we seek to solve here at Augintel, and Brian did a good job of teeing this up, but really what we've realized and why we started our business was that we recognized that narrative data is by far the largest and most valuable source of information and data about a case. And when we refer to narrative data, we're talking about everything you see in this blue pie chart, right? Our case notes, case plans, intake, medical documentation, you name it, anything where there's caseworker, staff inputting information into CAPS or your case management system, anything that's typed out in the form of narrative. And what our studies have showed us is that on average, about 80% of the information in a case management system is going to be in the form of that narrative data. The other 20% being this orange piece of pie here, that's the structured data. So thinking of your form fields, pull downs, and check boxes. And the problem has been that, historically, so many agencies are forced to make decisions or really evaluate data in the case management system based on the structured data alone. There haven't been tools that have really allowed you to dig into the narrative data in depth, right? And so often what we'll start to hear, whether it's on the front lines or it's all the way to supervisors or quality improvement, quality assurance teams, all the way on up to commissioners and agency leadership, hear a lot of different challenges that this then presents, where we're kind of blind to this narrative data. If you think about a new caseworker who just gets started and gets thrown 15 cases that are multiple years deep, I just don't have the time or the ability to go back and read thousands of contact notes. I'm getting more cases now than ever before. Or from a quality assurance perspective, just not exactly sure how indicative the QA process we have in place today is of the actual representation of our work, where maybe we randomly sample 10, 15, 20 cases if we're lucky a month or a quarter and look for certain trends across those cases, but it's the case that we don't review manually. It's the cases that are outside of that process that often become the ones that we're then reacting to, as opposed to having a proactive strategy into really understanding the narrative data. Also hear from several agencies that the narrative data quite often tells a very different story than the structured data. Maybe a caseworker forgets to check a box or select the right dropdown or go back and update that in the structured data. And so now we have a data discrepancy or a data hygiene issue based on the way that a caseworker is inputting the narrative versus the boxes that they're checking inside of the system. And these are just a handful of the problems that we hear every day, and that we're helping our clients solve. But you can put yourself in a variety of different roles, thinking of yourself from all the way caseworker to supervisor to CQI, all the way on up to your roles in leadership. These are pain points that we hear all the time. And that is really what led us to building Augintel. And what we've done here at Augintel is we've built a natural language processing model. NLP is a subset of artificial intelligence. It's really much more focused on the concept of information extraction, and the ability for computers to really understand not just the written word, but also the context behind the sentences and the case notes. And so we've applied a natural language processing model specifically to child welfare case notes. And that gives us the ability to detect and communicate critical insights and information about the children and families from the noise and chaos that can be that 80% of narrative data inside of your case management systems. As I mentioned, we are working nationally in a handful of states and counties. And so our Augintel model is, sole source justifiable. It's built, it's the only model of its kind. And we've trained that now on over 125 million actual child welfare case notes, and that grows every day as more notes come on in through Augintel from each of our clients that can then benefit the entirety of the child welfare universe that's accessing Augintel. So to help us kind of think a little bit about this before we switch gears into the demo, this visual representation will help you kind of understand what exactly we're doing here. And so we build an integration out of case management systems, whether it be CAPS. We're currently building the integration with Evanco to build an integration out of CAPS into Augintel for Washington County. We're currently live in Allegheny County and been integrated into their KIDS system for a couple of years now. But anywhere, whether it's case management system, timelines, reports, medical documentation, any narrative data that you have access to that you want to be run through Augintel, we build an integration to pull that data over into our AWS HIPAA compliant cloud and run it through our language model there. And on the other side, then what we're able to present to staff are key insights about the case, actionable insights, queryable results for leadership and QI, and also the ability to heuristically or Google-like search through the notes. So no longer having to rely on Control F and going note by note by note to search for keywords that might be spelled wrong. The model makes up for all of that. But as we go into the demo here in just a minute, again, this is a good visual representation for you to think about really where we're bringing the data and through our model, and then you'll see the information extraction concept of the insights that we're then able to deliver to caseworkers and staff to really promote critical thinking in the casework. I do think it's also important to shout out that we are doing nothing predictive here. Augintel is not a predictive modeling tool. We're not looking to say that staff should look at one case more than another. Again, it's all very based on the concept of information extraction. All of this data that we are then pushing forward to staff, to you and your teams, is information that's already in the system, right? It's case notes that your team has written, but so often get lost into the depths of the case management system. So I'll pause here and see, Tracy, anything else you wanted to add before we jump into the demo, or if we had any questions on the thread, happy to touch on that now. Otherwise, we'll jump on into the demo.
While you switch over to the demo, Alex, I'll just add, just to make sure it's super clear, one of my favorite things about Augintel is that there is no data entry. We take data that you've already entered into either CAPS or any other system and present it back to you. So it's a tool that's super helpful and not extra work, because it's so important that we don't add data entry burden, because there's already so much that's I'm passionate about helping improve the work, improving operations. And the cool thing about Augintel is it really does that at all levels. I think, the workers doing the day-to-day visits are critical, and to me, a priority to meet their needs. So we do that, but we also have lots of insights for all levels of leadership. So it's a one product that meets so many different needs of your agency. So I'm excited for you guys to see it.
Awesome. Thanks, Tracy. And I don't see any chats or hand raised in the chat here, but again, please feel free to raise a hand, unmute, or put a note into the chat here. But what you should be seeing now on my screen is going to be an Augintel demo instance. There's no PHI here. This is all demo data. But what you're seeing is the standalone version of Augintel. We're going to look at our cases and queries product dashboards today. So as we talked about before, right, what you're seeing here in essence now is there is no duplicate entry into Augintel. It's not another case management system. It's meant to sit beside of, on top of, or with many of our clients, we're embedded into their case management systems via integrations. But no caseworker has to do additional work to input anything into Augintel. We're pulling all of the narrative data, all of the hierarchy, case assignments, all of that critical information is coming directly out of the case management system and into Augintel. And so when an individual logs into Augintel, whether it's on desktop as we're looking at here, it's also built mobile first and mobile friendly, can access on cell phones or tablets, going to land on the case pages here. And the cases dashboard is most commonly utilized by frontline staff, case carrying individuals, supervisors that are covering cases for caseworkers. But you can see in this demo instance, as a caseworker, I've got 12 cases assigned to me here. As a leader, I also would have the ability to filter via, throughout your county, whether it's region to region, team to team, unit to unit, or filter in to see a specific caseworker's caseload and assignments. Again, all of those permissions are set up to be, to mirror, in essence, what you have in your systems today. So we're going to go ahead and jump into then the Dobson family case here and take a look at what's going on under the hood here. And so when I go into the Dobson family case, you're going to see on my left-hand side, I have my overview, and on the right-hand side here is the timeline. And I'm going to start here within our timeline. And what you can see here now is there's 131 different pieces of narrative, or 131 results that this client has said, they want Augintel to run through the language model. Those are going to be listed for me here in chronological order. The most recent case note having been input on Monday of this week. I can scroll through and see all case notes here. But if I pop open the case note, this is really where the secret sauce that is Augintel comes into play. So you can see the case note here now, and what Augintel is doing is the model is trained again on 125 million plus case notes throughout the country, with subject matter experts helping to label the data and continuing to improve model accuracy every day. But you'll see here now there are things that are highlighted in red and green, and you'll notice names are bolded. So what's happening in the red, those are going to be our risk factors. And so any risks associated with the case are going to be in red. Any strengths are going to be highlighted in green. And so again, we're looking for risks, strengths, social determinants of health, and people are really the key items that the model is trained to search for upon here. And you can see in this first sentence labeled in red that the worker informed Ms. Dobson's of the court's decision to file or order a TPR. The model is picking up on that determination of parental rights, labeling that as a risk factor. You can see a handful of the other examples here, and we'll go through the library of our risks and strengths in just a moment. But also easy for a caseworker now with this to vote both, again, on desktop or even in the field. We've heard from many a staff that it's just easier to even go note by note, utilizing Augintel to go to the next case note and review notes in this manner if need be. But everything then that's happening here within our timeline and all of those labels are then populating our overview here on the left-hand side. And so this risks and strengths tab, you can see this case opened up in August of 2022 and takes us up through present day. And if I go left to right along each tick, each tick mark here or each bubble icon top of the tick mark, that is going to indicate, month to month historically over the history of the case. The bubbles indicate frequency of said risk or strength. The larger the bubble, the more frequent that particular risk, strength, or social determinant of health was mentioned in that particular month. What we're going to do here now is we have a library of about 120 risk, strengths, and social determinants of health that we've built for and with our clients, continuing to evolve that library all the time. There is a lot going on under the hood that kind of populate each of these risks and strengths, and can always do a deeper dive on that with you and your county teams in another conversation. But what's going to happen now is what we'll do is we will bubble up towards the top those instances, those risks or strengths or protective factors that come up most common in this case. So you can see substance abuse is something that has been very commonly brought up throughout the history of this case. And if I scroll down, you'll notice there are a whole bunch of other items that maybe are just mentioned once or twice in the notes, right? But that often becomes the things that are so often and easily missed. So for example, if I look at this case and I can see, well, it looks like, over about a year ago, there was a mention of physical neglect in this case. Well, as the caseworker, I probably am not going back when I first get assigned this case to read a year's worth of case notes before I have to go see the family. And so this now gives staff the ability to click with one click of a button. I can go directly to the notes in January of this year, pop open that note, and it takes me exactly to the risk factor associated with physical neglect. And so it saves me and gives me the efficiency and time savings to not miss any of this kind of critical information and really getting caught up to speed and understanding a case as I, inherit it. You'll also see, as I'll scroll down to the bottom, you can see some of the other terms. But if I come, on back up to the top, what a lot of staff also recognize is that they're able to then utilize this to start to look at different trend lines, perhaps. And so you can see, as I mentioned, clearly substance abuse and misuse was something that was very prominent in this case all the way on up through June of this year. And then it hasn't really come up too often in the last 4 or 5 months. And that's an insight now that a caseworker and their supervisor can tackle and discuss together. Is that because there's been intervention? Has there been other programs provided? What has, caused that change, right? And just an entirely different data-driven mentality that allows our clients to really look at data again and look at a case in a very different way, and creating a lot more proactive versus reactive strategies in, caseworker to supervisor one-on-one type of engagements. Similarly to our risks and strengths tab, this people tab is going to do very similar work here, but it's looking much more at individuals mentioned in the narrative. And so this function is utilized all the time by caseworkers, family finding teams, folks looking for fictive kin. So often in the case management system, we might have structured data, or we may list 4, 5, 6, if we're lucky, 10 people associated with the case, whether that's mom, dad, foster mom, family members, fictive kin, etc. But so often we miss all of the other individuals that are mentioned historically in the case notes. And so what the model is doing here now is we looked at in the notes, all the individuals that are called out and bolded, those names now are put into the same chart that we saw in risks and strengths. And so you can see mom and dad in this case bubble up to the top. It looks like mom is mentioned in almost every case note. But now what family finding teams that we work with and utilize our product so often will tell us is they find that, and there's an unfortunate situation where they need to think about placement, perhaps they come to the people tab and they can now come in down below. And so often here is where they're finding, siblings or family members, fictive kin, people involved in the case that might have been mentioned 2 caseworkers ago and 3 years ago, right? Or a year ago. But people that we weren't aware of, right? And so this now gives staff the ability to say, well, who is Miss Saunders in this case? Let me go back to the narrative with one click of a button and understand the relationship that Miss Saunders had with the family. We will also be able to pick up on, in this case, if there are different misspellings or if there are different acronyms. So if, we're calling mom just M within case notes, or we'll see PGM for paternal grandmother all the time, those kinds of aliases, if you will. The model is trained to structurally put those individuals together. And so in this instance, we can see that Miss Laverne Dobson is the mother in this case. And she's referred to in all of these different ways throughout the history of the case notes. We additionally, if there is any information in the narrative, such as contact information, addresses, phone numbers, etc., the model is trained to call that out here as well. And with one of our client users in Allegheny County, they mentioned, as they started using Augintel, one of the things that they were able to do was, so often every time they would engage with a certain family member in a case, it would be a different cell phone number. And so she wasn't in the habit of going back into their case management system and updating the structured data phone number, but she was used to in her case notes saying, I reached mom at phone number XYZ ABC, and put the phone number right there. And so now very quickly and easily, staff has the ability to click into the notes and understand what was the most recent phone number that we were able to reach this individual at, which becomes critical. On average, across our clients, they're finding about 3 times the amount of placement candidates in half the amount of time utilizing this people tab here within Augintel, which is obviously a massive time saver, but also more importantly, calling out all individuals that may present an opportunity for placement as opposed to looking at foster care. So I'm going to pause here before we take a look at search. But Tracy, anything you wanted to add here on the risks and strengths people tab?
I'll just add on the family finding use case that not only can you get to the people, but you get immediately to the context around them. So oftentimes I'll talk to workers about how they were able to roll people out, really quickly so that they didn't sort of waste time in a crisis moment, sort of going out, doing clearances when it's actually that has been done already in the past. They can get right back to information, or again, like Alex said, get the contact information to just move way faster in that moment where, timing is critical, especially to find kin. The other surprising use case of people that I hadn't considered when we first deployed Augintel was collateral contact. So you can see here, we're pulling all people, and that includes the guidance counselor and the therapist. So when a worker's preparing for a court report or to call that collateral again before closing or something like that, workers will find the name of the person and just go back to the last note, because it's probably been a while and they've probably called 10 guidance counselors over that period of time, and just remind themselves of that context. So then they can just be more efficient and do more quality contacts and really not have to repeat some of the questions that had already been asked. So the use case here on people and the risk and strengths are so broad, and it really varies between workers and supervisors how they use it. Supervisors love when they get a phone call. They sometimes have to answer fairly blindly. So I have a lot of supervisors who just turn to Augintel immediately to find the person that called. Just like, what is the context around this person, so I can have a good conversation that's meaningful instead of asking all those basic questions that you need to know.
Awesome. Thanks, Tracy. The other thing that I'll touch on here within our each individual case is this ability to search notes within the timeline. And this is what I mentioned, many clients and users will say it feels like now I have the ability to Google my notes, right? This is built heuristically. And so if a caseworker is looking for, anything related to drug use or substance abuse, rather than having to keyword for drug, then keyword for drugs, then heroin, then methadone, then overdose, the model understands that if you're searching for drugs, thematically, you're probably going to want to see every mention of drugs, heroin, overdose, methadone, et cetera. And it takes you here now to all the different, the 26 results where drug or substance abuse concepts were brought up in the case. And this becomes really important for, putting together case reports, court reports. We've seen staff utilize this in court hearings where the judge might ask a specific question about the case, and maybe we don't know exactly where that lives in our narrative, and we want to make sure we're giving the perfect answer that's based on the narrative. This allows us to get to that information quickly. An example, real life example recently had a caseworker in the field where the judge had asked specifically about home cleanliness issues, was something that had come up historically in the case. And the caseworker remembered that last year there was something in this case as it related to home cleanliness issues, but was it bugs? Was it mice? Was there food on the floor? What was going on exactly there, right? And so this caseworker in real time, as the judge asked, had Augintel up on her phone and was able to look specifically into saying, she typed in bugs. Well, it turned out there was no mention of bugs in the home, but the model understood, oh, you're looking for bugs. You're going to want to understand home cleanliness issues at scale, and provided the notes and data that highlighted where there was food on the floor and potential mice issue. And those are things that, again, it's just that recall in the real time and the ability to now go make sense and utilize the data that's here, again, in the real time, as opposed to having to go back and comb through note by note by note by note. So switching gears a little bit now, if we all take off our caseworker hat or thinking about instead of carrying individual cases, we're going to switch to our queries dashboard. And this is where we'll now step into more of, think about this being utilized more so by supervisors, quality improvement, directors, agency leaders, all the way on up to, commissioners, deputy directors. Those are the folks that are digging into queries to better understand not just what's going on in one individual case, but help me understand the narrative across the entirety of my county. And so what these queries do is now it gives you the ability to search across either the entire county, or you can filter again, team to team, unit to unit, region by region, however you'd like to set that up. But these queries then are broken down into a handful of different concepts around things like safety concerns and auditing issues, best practices, note quality issues. And we'll dig into a handful of these examples now. Safety concerns is definitely one that we see most commonly utilized by our clients. And a couple examples here is I'll start with sleep safety awareness, where as we started working with counties and states throughout the country, super important for caseworkers to ensure that not only are they having conversations with caregivers about safe sleep where there's an infant in the home, but also to ensure that that's being documented in the notes, because if it's not in the notes, it didn't happen, right? And so often what the quality improvement teams that we would engage with would tell us is, yeah, once a month, we'll randomly sample 10 cases where there's an infant in the home. We'll go read that case from front to back and ensure that there are discussions around safe sleep listed within the notes. If they are, great. We check that case and say thumbs up. If not, check mark, thumbs down. Typically we see that we do like 8 out of 10, 9 out of 10 are doing well. So let's just say we're performing at 90% clip on sleep safety conversations. But then what would happen is a month later, a different case that we didn't sample pops up where there's an infant issue. And we go back to the notes and we see there was no discussion of safe sleep with caregivers. And so now with one click of a button, what we're able to do for those teams is say, okay, well, show me all the cases that are live in our system today where there's an infant in the home and there's no mention of safe sleep. So again, Augintel is not doing anything predictive here, right? We're not saying that this case, we're not even saying that for sure this discussion never happened. We're just saying it's not documented in the notes. And so the model then is going and looking for all cases where there's an infant in the home and the absence of any safe sleep discussion. And so now you have the list here in this demo example. I have 2 cases that I can jump into, the Rodriguez and Diaz family, where Augintel is indicating there's an infant in the home, no safe sleep discussion having taken place. Now gives us, again, a very proactive ability to go back to the supervisors, go to the caseworkers that are managing and handling these cases and ensure that we have the discussion with them. Maybe we had the conversation, we just didn't put it in our notes. Or maybe we need to go revisit and have another conversation with them about safe sleep. And this is, a huge change to the way that CQI and leadership teams have been managing these kinds of processes over time, and just really kind of the tip of the iceberg on what queries can do. Before we dig into a different query example, Tracy, do you want to share a little bit about the work that Allegheny County has done with Safe Sleep?
Sure. The query development, before I get into the use case in Allegheny, is customizable. So it is something where my team in customer success, who are former workers, sit with leadership or teams that are worried about something that they can only find in narrative data. And we work with you to develop these. And we can do it pretty quickly, usually within a week or two. So what the Allegheny team has found many uses for queries, and they were actually pretty surprised at how many safe sleep conversations were not being documented, because they had done a pretty good job of educating their teams. They have booklets that they hand out to parents around the topic, and they are pretty confident the conversations are happening, but they weren't aware that they weren't being documented in the system always. So we sort of worked with them to establish a very simple protocol that they would simply, the best practice team in Allegheny talks to each individual worker once they sort of appear on the query. And they were so surprised at the lack of effort they had to make, because we were handing them the records of concern. So they didn't have to sample any cases. to try to understand the problem. They didn't have to, pull all infants and go double check everyone. We do that for them and really just hand them the ones that are problematic, which allows them to simply go and address those proactively, like Alex said. So they improved their numbers really quickly. It was 30 days. They had improved by about a third and continued to work on it. And now they really just look weekly and they address them right away to sort of just make sure it doesn't become an issue in the future. So that's been a very powerful tool, and the safe sleep conversation is always in narrative. So it's a great example of how it can be used. And then once Allegheny sort of did it hands-on, they sort of started to understand the value. And now we're looking for, opioid mentions and stimulants and safe storage of weapons, for example. So there's lots of ways now that you can think about developing queries. And we do that alongside you. And we help to think about, well, what is this going to help you do on the ground and how can we support it ongoing? So there's lots of collaboration with your customer success team that goes into this and to meet your unique needs, because we understand every county in Pennsylvania has its unique problems and issues that you'd like to see in the narrative.
Awesome. And on that point of even, gun safety or lock boxes in the home, another query that we recently developed with our clients at Illinois DCFS was around worker safety concerns, where they wanted to ensure that anytime there's new staff that's getting assigned cases for the first time, or staff in any manner that's assigned a case where there's a history of unsafe weapons, pets, or gun violence in the home or community, to ensure that they at the very least are aware that that is associated with the case historically, whether it was last month, last week, or if it was 2 years ago, right? And so their issue on this was that the way they typically would go about it is, if it wasn't in the structured data, they would rely on the caseworker having read every single case note, which we know is not possible, right? And so with one click of a button now, they can see all cases where there's mentions of unsafe weapons, pets, or gun violence in the home or community. But even more importantly than creating a report for leadership to see, what we're able to do is also turn these queries into email alerts. And so we now, with our clients, anytime there is a new case assigned to them where there's a history or mentions of gun violence in the home or community, we're able to deliver this kind of email alert directly to the caseworker to ensure that they are aware and take them directly to those notes within Augintel so they can get caught up to speed. And again, nothing that we're doing there predictive. This is all in the notes. And just calling them back to exactly the data that is in the notes that they have access to, but 9 times out of 10 wouldn't have had the ability, time, or wherewithal to be able to get back into those notes, in this instance, from like 15 months ago. Some of the other query concepts, as I mentioned, are things around like auditing issues, best practices, eligibility opportunities. As Tracy mentioned, again, we're building these out every day with our clients. And as new things come up in an agency or new trends we're starting to see across the country, across the state, across the county, able to help partner and work with you guys to develop a query that you can make immediate use of. Another one I'll call out are these note quality issues, where we're looking for the duplicate notes. So are there case notes that have been copy and pasted month over month or week over week, or shorter incomplete notes where all the time, caseworker starts to sit down, put in their notes, and then an emergency pops up all too often, right? And it's not because they meant to not finish their note, but there's something a little bit more pressing in the moment. And you may see a note that says, finish note later or note to follow. This is a way now where we can call that back to not only the leadership team, but also to the caseworkers themselves and just remind them that, hey, you got to make sure you go back in to finish this note. And that's become a super valuable tool for CQI as well. Other thing I'll touch on here with queries is I mentioned a bit earlier around kind of data hygiene and really thinking about the delta of what's going on in the narrative versus what's in the structured data. With a client recently, they had some challenges in really understanding and getting an accurate count of the children under their care that were on psychotropic or prescribed psychotropic medications. The way that they would typically go about that, again, is their CQI team would pull a report directly out of the case management system that was based on how many cases had a checkbox clicked that said child on psychotropic meds. But what happened again and again was that they'd be in court or reviewing or prepping for court, and they'd realize this case actually, our understanding is the child's not on psychotropic meds based on the structured data, but the narrative is telling us all over that there are psychotropic medications prescribed and mentioned in the notes. And so now what we were able to do with this client is show them a list of cases within Augintel where there was a mention of psychotropic medications. Again, not predicting or saying for certain this child is prescribed psychotropic meds, but combing the narrative for them and bringing all of those cases to the forefront. So now they could compare the 125 cases that Augintel pulled versus about the 85 that they had in their structured data. And that's a delta of about 40 cases that they had there, where now CQI could very proactively go to those 40 cases or go to the supervisors of those 40 cases and just indicate we have a data discrepancy issue here, right? Your narrative is not supporting the structured data and vice versa. And that is again, something that so often historically has just been glossed over, or just something that we've assumed is an okay problem to have because we don't have the tools to do it. And that's exactly, what Augintel can do and help solve for your agency. So I'm going to pause here. That's a wrap on our demo piece. We're going to jump back into a couple of slides here to wrap us up. But before I leave the demo environment, good stopping point to see if there are any questions, thoughts, feedback. Otherwise, we'll keep going, running along here.
Hello, my name's Luann Hartman. I'm from Venango County. I do have a couple questions. The first one, if you were to install this in Venango County, would it go back 5-10 years and pick up the wording that we've been talking about, or would it start when you install?
Yeah, that's a great question. I'll take half of it and then kick half of that to you, Tracy. I think first on the question on, how far back do we go? Typically what we do with a new client is we'll take 10 years of historical data and ingest it into the language model to make that specific to your county and start doing some of the model training, model learning, and understanding of that narrative. And then we're able to move forward from there. And I'll turn it over to you, Tracy, to touch on the other piece of the question.
Sure. Thanks for the question. It's a good one. Like language, especially if you're talking about street drugs or programs that you use in your counties, does change over time. So during our initial onboarding, first few weeks, we just try to understand from you some of the acronyms that we're going to see in your notes. What do they mean? What are some of the language things? So the model does a fantastic job of understanding language. There are, like, if there's something very specific to your county only, it has to learn it. So we sit with you to understand those. And I'll give you an example. In Allegheny, they use POWER. I'm not sure if other counties use POWER. POWER is spelled POWER, all caps, all the time in notes. That is a drug and alcohol assessment. So we understand our model. When a worker puts in POWER, we know substance use misuse, and we can tag it appropriately. Another thing, I think in all of Pennsylvania, you all have shelter hearings. When we first deployed Augintel or looked at a test version of it in Allegheny, it was flagging that as homelessness or housing insecurity. So we just had to inform the model essentially that no, that's a hearing. So now it can separate out based on context if you're talking about a court hearing, if you're actually talking about a housing instability problem. So we did do a little bit of that discovery with you at the beginning. So then the model understands your language and does grow with you over time as well.
Thank you. One more question.
No
We have the enterprise system that's supposed to come to Pennsylvania, maybe sometime this century. We don't know.
Can't wait.
Yeah, right. It won't be an issue working with that system as opposed to CAPS that is, mainly through Pennsylvania.
Yeah, a great question, Luann, and absolutely. We So the way that we're working with counties now, right, is we're integrated to CAPS or KIDS or, you name the case management system. But we also have been very much engaged with the state and also all the way at the federal ACF Children's Bureau level, talking about funding streams, mechanism, those kinds of things. But to your point around the systems themselves, with our existing clients, as soon as there is said case management system live in Pennsylvania, what we will do is we'll just be able to point the integrations on over. So if it's plugged into CAPS now, we'll plug into the modern system probably a little bit even more easily because it'll be a cloud-based system. I think we all would hope and think potentially it'll be easier to integrate with. The thing that we're also pushing for, right, and on our end would be as we engage with the state, our belief is that the state should have Augintel in this new case management system and accessible to all counties as part of that program. And so with, existing clients and counties that we're currently working towards contracts with, if that is something we're able to achieve with the state, then at that point, we would essentially just cancel the contract with the county, move it to the state. Your access doesn't change in any way.
I see. Thank you very much.
Yep. Great questions. And Carl, you've patiently had your hand up and great to see you on camera. How are you?
I'm good. How are you guys?
Great.
A few questions. Well, first, are we going to get any information about pricing in the presentation today?
So we can give, pricing is really based on a couple of things. It's really the first and foremost kind of volume of users that you'd have within your agency. So how many folks have access to your case management system in your county, combined with the volume of narrative data. So really how many case notes on average are coming in annually? What does the historical data look like, to Luann's point, over the last 10 years? Because really that's, our pricing is based, it's really a software as a service type of a model. And so once we deploy the product, there are no additional change orders or any, licensing additional fees, right? It basically at that point, you have access for your agency. And so pricing, again, it's not going to be the same necessarily for every single county depending on size. As part of like a follow-up conversation, I think, would be happy to dig more into each individual from a pricing scenario. But generally, the way that our contracts work, big picture, is we start with a 6-month services agreement that typically kicks off on day one, same day as a software, as a subscription licensing agreement. And that 6-month services agreement is going to do a lot of the things Tracy mentioned. That's going to build out integrations out of your existing system, understand your hierarchy, permissions, specific taxonomy to your county, aligning to business and starting to think about how do we best deploy and train your staff to meet them where they're at. And then after those 6 months, the solution's live and ready to go. It's then at that point just, a software subscription. We do offer, our standard contracts are 3-year software agreements. We do also have the ability to do a 1 or a 2-year agreement. But to give you kind of a ballpark, I think our services typically are going to be anywhere from, $90,000 to $200,000 for that first 6 months to get set up. And then again, depending on the size of the agency or the county, it could be anywhere from, say, $150,000 to $300,000 a year in software subscription. I'll touch on this a bit later as well, but in our engagements with the state, they've requested that if there is interest from any county that you engage with your state liaison, because we have worked with the state and also with the feds, as I mentioned earlier, to get approval for sole source justifications, which would allow for certain funding mechanisms via IT budget for matches or I guess, reimbursements or payments from the state in some way. So more detail to that, Carl, I think, for each individual county, but that's kind of big picture.
Yeah. Overview sort of information is what I was really interested in. Thank you. Second, just to the point of the, that there's nothing predictive involved, and maybe I'm just looking to verify observations. When we were under the cases tab, I think we were, do I have it right that what we're seeing is essentially highlighting of the existing narrative information, not necessarily that the system comes up with its own narrative
Exactly.
to summarize things. Okay.
Yep.
Yeah. The only thing we're
Uh,
adding is we're adding the highlighting to your sentences and
Got it.
indicating that in your sentence, we see a certain topic.
Right, right. But I see the value of the tool bringing that to the forefront. That I understand. And then finally, my last question had to do with, let's say under the cases scenario, let's say we've got two different ones in there. Besides the Dobson family, we have the Smith family, and let's say Smith is parent to some children on Dobson, and Dobson is parent to some children on Smith. Does the system pull that kind of together without being told to, or is there mechanisms? We have some complicated family structures, and I'm sure that's something you've heard from others. But just in terms of, will that pull together any of that information and tie it together?
Yeah, that's a great question. I don't think we showed it in the demo, but we have a connected cases feature, which does exactly that. What we're doing is we can do this in two ways. We can take some systems have these structured connections made. So if there's like an investigation record and a case record that are actually the same family, we'll take that connection and make it here. But the other thing we're doing that is pretty powerful is looking by person and saying, okay, so Henry Patterson is the father for the Dobson family. He actually happens to also be the father for the Hoffman family. So we're showing you this in the connected cases that there's a connection here. We're telling you which person is the connecting factor and then letting you get right to the Hoffman family to understand, sometimes actually we've had workers find siblings this way that they didn't know about. And, then they're able to make those connections, which is really powerful on the ground.
So do I have it right that the answer is kind of both, that we can manually connect cases within the system, but also the system will point out that there is a connected case in instances?
That's right. If your system already knows it, we'll take it. But yeah, we also do our own analysis to be sure there's nothing missing and show it to you. Saw someone else's hand go up, Alex.
I think I saw, yeah, Jason went up and then down. Jason, did we cover your question or just being polite? Maybe we covered it. Oh, mic is off.
Oh, your mic is off. I'm so sorry. I tried to get everybody. I'll get you real quick, Jason. A second here.
I think it's enabled, Jason. If you just hit,
Yep.
if you hit
You
unmute.
should be able to unmute on your end. Yep. Sorry, you're having trouble, Jason.
Looks like you'll go ahead and put it in the chat, and if you can't come off mute, apologies on that. Got it. Okay. Thank you, Jason, and sorry about that, but we absolutely can follow up post with any questions. If I jump back into a couple of things here, we touched on a handful of different use cases. Want to revisit a couple of others in our remaining time, and then chat through what makes sense for some next steps if you're interested in learning more about Augintel. So I'll kick it over to you, Trace.
Yeah, thanks. So you saw our search, and I just wanted to share some common search terms. This is over the last 3 months what folks typically have been searching for. So this sort of makes you understand a little bit more of the use cases in the ground. So whether you're about to do a service referral, just trying to understand the history of the family, looking for past trauma, these are some of the terms that can get you right to that information. So folks find medication really well. So if you can type in medication, you'll get back Adderall. It's not looking for the word medication as a reminder. It's looking for what kind of medications are prescribed. You'll get prescription medications, any mention of pills, etc. You'll get all that information. So folks find a lot of really great information through the search because it is so broad. They can also look for very specific information as well using quotation marks, which is helpful.
I would add, even on this, one of the interesting things that this kind of word cloud concepts allows us to do is, our customer success teams then work with your team, in quarterly business type reviews to share, these are the most common search terms that we saw across your agency this quarter or this month, right? We can pull that at any time for you. And this has helped many of our agency leaders then understand or seek to understand, well, why are there so many folks, searching for, mental health diagnosis, right? Or, fentanyl or window safety. And those are just a handful of different kind of terms that have popped up over the course of time with our clients that then allows agency leadership to understand, well, there's got to be a reason why this is being searched all of a sudden more and more commonly within Augintel.
Yeah, that's a great point. It really does help us understand what our users trying to get to, so that we can even better meet their needs. Real quick, I see Jason's question on connected cases, so I'll answer it. So if we connect a John Smith for multiple cases, there is no way currently for a worker to say, no, that's not correct. But I'll clarify that we use person ID from your system or whatever that ID per client that you use, because it is really tricky. John Smith, of course, is going to be present in many cases. So we're not using narrative data to make those connections. We are using person ID, so it slims the chance of it being incorrect. Certainly could happen, and then we would work with you to try to fix that.
And I'd add to that too, Jason, that it's something that it's not that we don't have the capability to do that, but very intentionally in our product, we want to continue to make sure that staff doesn't feel like they need to go to Augintel to do any work per se, or like input any data or take action in Augintel. Just it's their information extraction, right? When they are sitting down to do a court report, sitting down to do quality assurance reviews, right? Like we're going to Augintel to review data. There are ways to provide feedback to Augintel directly in the product, but we definitely, many of our clients, want actions to take place for the caseworker in the case management system without, having to go to Augintel to do any of that action, if you will, right? And so I think we could talk more specifically too about Jason in Westmoreland County, like what some of the capabilities would be of embedding Augintel into the case management system and things of that nature. So great question.
I'll finish this slide up and then maybe we'll wrap up, Alex. But fatherhood engagement is a topic that comes up a lot that can be supported by Augintel. And connected cases, like we were talking about, is one way folks understand, how is father engaging on different cases. And they can, this worker in particular in the quote in the bottom, really did some digging and really went into that connected case and tried to understand what the situation is with dad to help her continue to engage. So that people tab, really trying to understand, even just to highlight when father engagement is an issue, is really easy because you can see, notes that mention the father. And sometimes when you don't see father listed at the top, I always encourage folks to just sort of pause and think about maybe why, and then go back through those past notes and see what has happened last or what's the engagement been like over time. So it highlights the issue here that folks are paying a lot of attention to.
Awesome. Thanks, Tracy. We had a handful of other, use cases to highlight it. We are kind of running short on time, so want to highlight some next steps here and action items together. But we will be able to provide this deck as well, and so you're always able to review those use cases and follow up with us directly. So next steps, absolutely, we'll be providing, recordings to the recordings to the webinar via email. And the opportunity to follow up with us directly. If you're interested in further conversations specifically for your county, you can reach out to me directly. My email is included here, and we can do a deeper dive specifically with your county leadership teams. The other thing that, as I mentioned, with respect to the state, if there's any interest in Augintel at all, even if it's 5%, whatever it might be, the ask from OCYF has been to immediately reach out to Heather Doyle and Alyssa Springer. And, if you have a specific liaison that you work with as well, let them know so that they can start thinking about, state support and funding, sole source justifications that we've done that have allowed the state to then submit to ACF to allow for IT budget and reimbursements and things of that nature. Other thing I'd add is that we, are available on contracting vehicles via NASPO Cloud, Omnia. We have also contracted directly with counties. We have a lot of options there and happy to meet you in a place that's going to be best suitable to you and your county. From a customer references standpoint, we have a laundry list of folks at Washington County and Allegheny County that would be more than happy to speak with you all directly. I've included Director Ann Schlegel here, her contact info. In Allegheny County, Marin formerly leads their kids system today. She's their kids application leader. But also, have a handful of other contacts we can always connect you with, or would bet you guys all have a lot of relationships, obviously, there as well with both Washington and Allegheny. But always great to hear it from the customer as well. And we're happy to help connect those dots for you. So I know we're right at the top of the hour now, but really appreciate you all joining, the work that you guys do. And, we're really passionate about seeing what we're able to do to help just make caseworkers' lives just a little bit easier and utilizing data that's there within the systems. And so appreciate your time. Hope to meet with all of you again. Please don't be shy. Don't hesitate to reach out. You'll probably see Tracy and I at PCYA conferences and shows coming up. You'll hear from us again. I'll reach out to me, but pleasure. Thank you all for everything you do. And I'll stick around for a few more minutes if there are any questions, but I'll kick it back to you, Brian, to wrap us up.
All right. I just want to say thank you for taking the time to present on this. I think it's an interesting technology and can certainly save a lot of time and effort for caseworkers. So with that, thank you everybody for joining, and we'll make sure you get the slide deck. Thanks.
Thank you, everybody.
Thank you.
All right, Alex, Tracy, Lori, I got to jump off. I got a meeting with AOPC. Sorry.
Thanks,
Thanks,
Brian.
Brian. Take care.